Tonight, a first for the nation. A man is diagnosed with Ebola while in the U.S.
As Joe Chiodo reports, concern is high across the country. The possible spread of the deadly disease is on the minds of many.
It's been just 5 days since a joyful Dr. Rick Sacra left the Nebraska Medical Center clear of Ebola. Now, a new patient is diagnosed right here in the U.S.
We're really hoping for the recovery of this individual.
The CDC hopes the fate of the new patient being treated at a Texas hospital is similar to Sacra's, but the situation much different. This time around, some Americans could be at risk.
Someone who had contact with this individual, a family member or other individual, could develop Ebola.
We know the patient arrived in the U.S. on the 20th. He felt ill on the 24th and sought care 2 days later. He was then hospitalized and isolated on the 28th. The key is finding anyone who made direct contact with him during the 4 days after he felt sick. The CDC has an idea of who those people are.
We know that there are several family members. They may have been 1 or 2 or 3 other community members.
Once all are found, they'll be monitored every day for 21 days. If they develop a fever, they're isolated.
We're stopping it in its tracks in this country.
The man infected, now critically ill in a Dallas hospital, came to the U.S. to visit family. It doesn't appear he was involved in the fight against the disease, and the CDC isn't saying if he's an American. They can only hope that his fight ends just as successfully as Dr. Sacra's. And we're live here at Eppley Airfield, and a big question on the mind of many is, would the people on that plane with the patient be able to get that disease? And the CDC says there's nothing to worry about. That's because Ebola doesn't become contagious until the symptoms show up. And in this case, that didn't happen until 4 days after the new patient stepped off that plane.
Remember, NMC was chosen to treat Dr. Sacra because it has a biocontainment unit, and the hospital the new patient is at does not have one.
The CDC does say right now he is isolated and they see no need to move the patient.